The death of Sarah Harding from metastatic breast cancer at the age of 39 came as a shock to many of us. Sarah Harding was a singer in the band Girls Aloud that became one of the most successful girl bands in British music history. The band had 20 consecutive top 10 hits, 4 #1 singles, and released 5 studio albums. In this video, I will be recounting Sarah Harding's story based on the research available to the public, as well as her recent autobiography. Hello, my name is Dr Tasha and I'm a breast cancer surgeon. If you want to learn more about breast cancer and health, then this is the place to be. In March 2021, Sarah released her autobiography entitled Hear Me Out. Here, Sarah described how first she noticed pain under her arm whilst she was washing. As she felt around, she first then noticed that lymph nodes were enlarged in her armpit and they were a bit tender, and this was in December 2019. Her partner at the time also mentioned how her breasts were becoming slightly larger than usual, but Sarah thought her breasts normally fluctuate in size anyway, and so she didn't think anything of it. Sarah did finally have a breast ultrasound scan which picked something up that needed to be looked at in more detail, and so an MRI scan was advised. However, around this time, of course, COVID-19 hit and everything went into slow motion or even stopped completely. And I remember it was really difficult and a stressful time. People felt that they couldn't go to hospital unless it was felt to be a real emergency. And so Sarah thought that she would wait. She kept calm because she thought it was just a cyst, plus there was no history of breast cancer in her family. The problem for Sarah, though, was that the pain was becoming unbearable, and it didn't go away despite the painkillers that she was taking. She also noticed that there were blisters forming on the skin of her breast, and this also started to bruise. One day I woke up realizing that I'd been in denial about the whole thing, she said. Yes, there was lockdown, there was a pandemic, but it was almost as if I'd been using that as an excuse not to face up to the fact that something was very wrong. Sarah eventually went to the hospital and was diagnosed with breast cancer. She said, "When the doctor delivered the news that I had breast cancer, I was a mess, like anyone would be. Being faced with your own mortality is not something you would consider, but that's just how I felt that moment was for me. I just remember thinking, well, that's it, game over." So let's talk about some breast cancer stats. The majority of breast cancers are diagnosed in women aged 50 and over. In fact, 8 out of 10 cases are diagnosed in this age group, and 1/4 of these cases are diagnosed in women aged 75 years and over. Breast cancer, although not common, however, can affect younger women. Just over 4% of all cases are diagnosed in women aged 39 years or under, and this is the group Sarah Harding fell into. Unlike for over 50s, where there is a screening program, there is no effective breast cancer screening tool for women under 40. And this is because young women's breasts are quite dense, and mammograms are not particularly helpful in detecting lesions in dense breasts. Unfortunately, young women generally are affected by more aggressive cancers, and it has been estimated that just over 1,000 women under the age of 40 die from breast cancer every year. Sarah's treatment started with chemotherapy, which can be given either through the vein or by tablet form. If it's going through the veins, one way to minimize puncturing the veins over and over again is by putting a dedicated line through one of the big veins in your chest, and this is what Sarah had. She said, "One of the first things I had to have was a port fitted in my chest where the chemotherapy drugs could be administered, plus several other smaller ports for drips and other things. It was like being a bionic, and needles were coming at me from every angle." Now, one of the possible risks of doing anything invasive like putting a port is infection, and unfortunately Sarah developed really bad infection, or sepsis really, following this port insertion. It was so bad that she ended up in ITU and her lungs and kidneys started to fail. She actually stayed in a medically induced coma for nearly 2 weeks. Chemotherapy uses cytotoxic drugs to destroy cancer cells. Cancer cells are rapidly dividing cells, and so they are good targets. Unfortunately, chemotherapy can also target normal cells, and that is why patients experience side effects when they have chemotherapy treatment. Different people will experience different side effects depending on their body, but also the type of the drug that they are getting. For Sarah, the most challenging aspects that she faced with chemotherapy were the pains in her joints, as well as the side effects, the steroids she had to take. The steroids made Sarah gain weight, as well as making her more hyper and more chatty. Sarah was diagnosed with ADHD when she was younger, and so the side effects of the steroids made her even more hyperexcitable. Hair loss is also commonly associated with chemotherapy, and you can mitigate this by wearing a cowl cap, which you wear before and during, as well as after chemotherapy treatment commences. It works by cooling your scalp and reduces the blood flow to the hair follicles, and so this reduces the amount of chemotherapy that will reach them, and reducing the hair loss that way. Unfortunately, it can cause real headaches, and some people do struggle with this. Sarah used a cowl cap, and it seems that she managed to keep some of her hair. She said, "I had my chemo yesterday and it wasn't as bad as I thought, but now I'm just waiting for the after effects. All I know is that I'm feeling exhausted today. I had a cowl cap on during my chemo to save my hair. That's not necessarily going to work. I do know that I'm going to lose my eyebrows and eyelashes. So who knows if I'm going to hold on to my lovely blonde hair." She said, "Actually, there's not much blonde hair left anyway, thanks to the global pandemic. I might be going down with roots." So how does Sarah Harding cope with the media attention? Well, initially, Sarah didn't want the media to know about her diagnosis at all, and she's actually quite a private person. She wanted to keep it private and to share it with her family and closest friends only. However, a tweet emerged asking if anyone knew why Sarah Harding was seen at the Christie Hospital in Manchester, and this changed all of that. Sarah knew that before long, the wider public will be digging for information and the news will eventually come out. And so, Sarah announced her diagnosis in August 2020 through Instagram. As scary as it was to go public about my diagnosis, it was the right thing to do, she said. And the amount of support I've received is incredible. I've been inundated with lovely messages from my fans. I'm grateful beyond words for that. Unfortunately, Sarah's cancer progressed and spread to her brain and lungs despite her treatment. Sarah's death was announced by her mother through Instagram, and she wrote, "It's with deep heartbreak that today I'm sharing the news that my beautiful daughter Sarah has sadly passed away. Many of you will know Sarah's battle with cancer and that she fought so strongly from her diagnosis until her last day. She slipped away peacefully this morning. I'd like to thank everyone for their kind support over the past year. It meant the world to Sarah, and it gave her strength and comfort to know she was loved. I know she won't want to be remembered for her fight against this terrible disease. She was a bright shining star, and I hope that's how she can be remembered instead." Sarah Harding had achieved huge success, and she will be missed by so many. Her legacy will live on through her music, as well as her courage in sharing her story. By speaking out as a public figure, she said she wanted to help get the message across of how important it is to get checked if there are concerns. Her efforts has no doubt raised breast cancer awareness even further.